Okay, so let's go through the medications that we normally prescribe to people both for before and after surgery. Okay, so let's start with the preoperative medications. So the things that we're going to prescribe that we want you to use before surgery include the Hibiclens soap, and I talk about that in the general preoperative instructions about how we want you showering with a special soap which helps decrease the amount of bacteria living on your skin. So that's one thing to do. You're going to start using that a couple days before surgery. There's a scopolamine patch that we prescribe. It is a patch that you put behind your ear. You just put it right here. That's all, just in the skin right behind your ear right there. And you do that the night before surgery. And what it does is it really helps reduce your chance of being nauseous after surgery from the medications from the anesthesia. So if you're going to sleep, we're going to prescribe you a scopolamine patch and just put it behind your ear the night before surgery, just right there. And that's it. You don't have to worry about it. Now, if it falls off during surgery, it's not a big deal. If it's still on after surgery, that's great. Leave it on. But if you have a hard time peeing, in other words, you have a little bit of urinary retention, or your mouth is dry, or you're a little bit dizzy, just take it off. It's not that important after surgery. By then, you can just take it off. If it's not causing any problems, you might as well leave it on. It might help with nausea. But if it's making it hard to pee or giving you a dry mouth, making you a little bit dizzy, just take it off. When you take it off, don't touch your eye. Take it off with your hands. It's fine. And then throw it away and immediately wash your hands. Because the medication, if it gets in your eye, it's not going to hurt anything. It's just going to make your pupils dilate. And that can be kind of uncomfortable. Gabapentin is another medication we're going to have you take. So the 3 pills we have you take on your way to surgery. So the morning of surgery, basically, or if you're not first case of the day, I want you to take these medications around 3 hours before. So I tell people, take them on your way to the hospital or when you're checking in. If you're not the first surgery of the day, if you're the first surgery of the day, you can take it when you wake up. Anyways, so these are gabapentin or Neurontin, Celebrex, which is celecoxib, and Tylenol, which is acetaminophen. Those are the 3 pills we have you take before surgery. We're going to have you take 1 gabapentin, which is 300 milligrams, 1 Celebrex, which is 200 milligrams, and 3 Tylenols. So the Tylenol that we're talking about is Tylenol 325s. So you're going to take 3 of those. So you're going to take a total of 5 pills before surgery. 3 Tylenol, 1 gabapentin, 1 Celebrex. And these pills, these medications have been shown to decrease your pain after surgery if you take them before. So I don't want you swallowing the pills with water minutes before you're put to sleep. The anesthesiologist may delay or cancel the surgery, so do it a couple hours before. Okay. And also before surgery, if you don't have regular poops, if you're kind of an irregular pooper, then start taking some Pericolase to make sure we don't start out constipated. All right. After surgery, we're probably going to prescribe you some antibiotics. That's going to depend on your allergies and what we're doing, what area of the body we're operating on. So I'm not going to be too specific because the antibiotics are going to vary quite a bit. The most common medication we prescribe for prophylaxis or prophylactic antibiotics, since we're not actually treating an infection, is Keflex, which you take every 6 hours, which is 4 times a day. If you're having a surgery performed or a procedure performed under numbing medicine, in other words, we're not starting an IV, it's strictly numbing medicine, then I'm going to have you take the antibiotic before surgery as well, a couple hours before surgery, to make sure it's in your system. If you're going to sleep or if you're getting an IV as part of your surgery, then we're going to give you IV antibiotics before surgery. But if you're not getting an IV and we're doing under numbing medicine in the office, then I need you to take Keflex beforehand, but it'll all be prescribed depending on what we're doing, what your allergies are, and what area of the body we're operating on. Your antibiotic will be adjusted accordingly. For pain after surgery, most important thing, Tylenol. I want you taking 650 milligrams every 6 hours, no matter what, to prevent pain. That's 2 tablets of the 325s. So 2 325s, which equals 650. every 6 hours, no matter what. Set a timer so you take it every 6 hours. The Keflex is also an every 6-hour antibiotic, so if you're on Keflex, you can take it at the same time, so it's easier to keep up with it. Another medication you're probably going to be prescribed is a muscle relaxer. If we're doing a tummy tuck, breast surgery, anything involving muscle, we're going to prescribe you a muscle relaxer, which is Robaxin, which is methylcarbamol, is the most common muscle relaxer we use. Those generally come in 500 milligram tablets. I want you to take 3 of those every 6 hours, no matter what. So take it with the Tylenol. Every 6 hours, no matter what, 1,500 milligrams of Robaxin or methylcarbamol. Usually comes in 500 milligram tablets, so that would be 3 tablets every 6 hours. If you tend to be a really anxious person, we may substitute the Robaxin or methylcarbamol for Valium. Valium is also a great muscle relaxer, but it's also a benzo, which can make you kind of sleepy and altered. And I don't love prescribing that along with the pain medicine we prescribe you. Unless you're really anxious, we may substitute the methylcarbamol for Valium instead. Oxycodone is the narcotic that we normally prescribe. Our goal is for you to take as few of these as possible, but I want you to have them because there may be moments when you need the extra pain control, because I don't want you in excruciating pain. I don't want your blood pressure high. I don't want your heart racing. Those are not good for healing. At the same time, I don't want you taking so many medications that you're not breathing. So the reason we like oxycodone is Percocet. Is because it can be prescribed pure, meaning it's oxycodone immediate release tablets, and that way you can take Tylenol, like I told you, 650 milligrams every 6 hours, and I don't have to worry about you overdosing on Tylenol. If I had you taking Tylenol 650 every 6 hours no matter what, and prescribed you Percocet, which is oxycodone stuck to Tylenol, you may end up taking too much Tylenol, which is bad for your liver. So I want you taking the max dose of Tylenol, which is 650 every 6 hours no matter what. And then the oxycodone we prescribe you is pure oxycodone, which is basically Percocet without the Tylenol. And so you can take this only as needed for pain that is not controlled by everything else. So if we give you oxycodone, it generally comes in 5 milligram tablets. Take 1 to 3 of those. Now, I want to be clear about the oxycodone. I want you to take the least amount you need, and I don't want you to take 3 at once. I'd rather you take 1 and wait a little bit. If you're still in pain and wide awake, take another one. If you're still in pain and wide awake, take another one. And in general, you'll fall into a routine of taking anywhere between 1 to 3 of them every 4 hours. But only take those as needed, because they're going to make you constipated. They can be addicting, and they're the drug with the worst side effects, but they're also the drug that does the best job treating pain. So it's kind of a catch-22. But the way you would overdose on oxycodone, it would be like a heroin overdose. In other words, you're going to stop breathing, and that's how you would die from oxycodone overdose. The way you overdose from Tylenol is you get toxic and you don't know it. It hurts your liver and you go into liver failure, which is why I don't give you Percocet, and I control the amount of Tylenol you take by telling you to take 650 every 6 hours. That's totally fine. The oxycodone, if you're wide awake and in pain, you can take another one. That's not oxycodone. You know when you've taken too much oxycodone because you'll be really, really sleepy. That's how you know. So I'd rather you take, like I said, 1 tablet over time rather than 3 tablets all at once with the oxycodone. And then the stool softener, the stool softener is pericolase, which is colase and senna in 1 pill. And that's a great stool softener just to prevent you from getting constipated, because if you're taking oxycodone or any narcotic, you're going to get constipated. So you need to make sure that you're taking the stool softener, which is usually 1 tablet every 12 hours or 2 tablets once a day to keep you pooping. Help prevent constipation. And then the Miralax, the milk of magnesia, all those things are for if you become constipated, which hopefully the pericolase will prevent. The last medication would be Phenergan or promethazine. This is for nausea. Basically, take 1 tablet every 6 hours as needed for nausea. You only take it if you're nauseous. We usually give people Phenergan because it has a couple other side effects that are beneficial. It works a little bit like Benadryl, so it can help with itching, can make you a little bit sleepy. because everything's better if you're a little bit asleep. You're not itchy. You're not in as much pain. And so that's the advantage of Phenergan. We might also prescribe Zofran, which is ondansetron. That usually comes in 4 milligram tablets, which you can take 1 to 2 of those tablets, again, every 6 hours as needed for nausea. There's also a Zofran tablet that dissolves under your tongue, which we can prescribe. So if you're nauseous and you can't swallow a pill, you can at least let this dissolve under your tongue. The last medication which I could prescribe if you need it is a Phenergan suppository, which is Phenergan, but you stick it up your butt as a suppository, because if you're so nauseous you can't keep anything down, you have to put it up your butt. That pretty much summarizes the typical medications we would prescribe to a surgical patient. About the oxycodone, with the new laws in Florida as well as the opiate crisis, we cannot give you or replace your prescription if you lose it. So I want you to treat all of your prescriptions like cash. If you lose them or they get stolen or whatever happens to them, I can't give you another one. So I need you to treat it like cash. And that's sort of the main stuff. Usually what happens and how this goes down is I'll call to check on a patient the night after surgery, or if sometimes they'll get a hold of me before I even try calling them, and it's usually the wife is in pain from a tummy tuck or breast surgery or whatever she had done, and the husband or the wife's on the phone and telling me that, you know, she's in pain, they're not sure what's going on. And once I explain to them how to take the medications they're prescribed, everything's better. So the most common phone call I get about people being in more pain than they expected is because they're not taking the medications like they're supposed to. So review this video, take the medications like we want you to. If you're still in pain, or it's not working, or you're having bad side effects from the medications, by all means, let us know so we can get it fixed. We do not want you feeling like crap any longer or any more than you have to. We want your experience in recovery to be as comfortable and as seamless as possible. Depending on what procedure you had done or what procedures you had done, as well as depending on your pain tolerance and how you experience pain, there will likely be some pain that you'll have to endure and deal with as part of your recovery. Again, pain is a very personal experience, and I promise you that we will do our best to make sure your pain is as well controlled as we possibly can. But there are circumstances and there are people who are very sensitive to pain, and there's no way of keeping them out of pain and keeping them awake and breathing at the same time. And so just know that we will do our best to keep you comfortable and to treat your pain as safely as we can, but that you need to be awake and breathing. And so that's the limit of treating your pain, basically. And that's why the other medications, like taking the muscle relaxer, the Tylenol, scheduled around the clock, is so important. Taking the Celebrex and the Neurontin and all those other medications before surgery is also very important. And another great way to help treat pain is once you're 3 days or 72 hours out from surgery, you can start taking ibuprofen. So then what I want you doing is once you're 72 hours out from surgery, start taking ibuprofen along with the Tylenol and the muscle relaxer every 6 hours. So at that point, you'd be taking 650 Tylenol every 6 hours, 1,500 of muscle relaxer every 6 hours, or the methocarbamol, and finally 600 milligrams of ibuprofen every 6 hours. That's usually 3 tablets. Ibuprofen usually comes in 200 milligram tablets, so to take 600, you need to take 3 of those tablets. Ibuprofen can also be a little hard on your stomach lining, so take with a little bit of food if you can. But to keep you compliant and on schedule, I would take the muscle relaxer, the Tylenol, and the ibuprofen every 6 hours, no matter what, round the clock, to help prevent pain. Because all those medications do a great job treating and preventing pain with very little and few side effects. But again, I don't want you taking the ibuprofen for 72 hours, for the first 72 hours after surgery, because it will make you a little bit more likely to bleed. But after 72 hours, I'm not too worried about you bleeding anymore. And so it's okay to start taking ibuprofen then, which will also do a great job helping treat your pain. And our goal is to treat your pain and keep you awake at the same time. I hope you found this helpful. Please check out our website, restoreplasticsurgery.com. There you will find a price estimator that can estimate the cost of any combination of procedures that you might be interested in. You can also use our virtual consultation tool. It's essentially a way for you to send us your concerns along with photographs of your concerns, and we will respond with an assessment and our recommendations. On our blog page, there is a recording function called the Speak Pipe, and it's a place where you can leave audio recordings of your questions and things you would like discussed on a future episode. Finally, please follow us on Instagram and Facebook, and also check out our YouTube channel. Subscribe to the YouTube channel if you're watching this on YouTube right now. And lastly, we also have a podcast, Plastic Surgery Q&A, and you can subscribe to that podcast and listen to those episodes at iTunes or wherever you get your podcasts.